Right now, over 150 million people around the world are taking one tiny white pill every single day. It's called Metformin, and most of them have no idea what it's really doing inside their bodies. This pill doesn't just lower blood sugar. It rewires how your liver, muscles, and gut cells produce and use energy, at a level most people never see. But there's a darker side too, one that doctors rarely explain clearly. By the end of this video, you'll understand exactly how Metformin works and what it can cost you. Welcome back to Diabetes 2 Reversals. Today we're breaking down Metformin, its mechanism, its power, and its risks, using real medical science, not myths. Metformin's story begins centuries ago with a purple flowering plant called Garliga officinalis, the French lilac, used by medieval healers to ease the symptoms of diabetes. In 1957, French physician Jean Stern isolated the active compound and named it glucophage, meaning glucose eater. His research laid the foundation for modern metformin. By 1994, the FDA approved metformin in the United States. Today, it's the first-line treatment for type 2 diabetes, recommended by doctors worldwide. But what actually happens once metformin enters your body? Let's go where no eye can see, deep inside a single liver cell. Metformin activates a master energy switch called AMPK, the AMP-activated protein kinase. Scientist Graham Hardy's research revealed this enzyme controls how cells sense and manage energy. Inside the mitochondria, the cell's power plant, metformin mildly blocks complex 1 of the respiratory chain, slightly reducing how much energy the cell produces. Metformin builds up inside mitochondria and partially blocks complex 1 of the electron transport chain, the enzyme that normally pumps protons to power ATP production. With complex Y slowed, proton flow drops, ATP synthase makes less energy, and the cell's ATP to AMP balance shifts. This drop in energy production raises AMP levels compared to ATP. That shift is the exact signal that switches AMPK on, changing how the whole cell behaves. Metformin also suppresses key liver enzymes like glucose 6-phosphatase, directly cutting off the final step that releases sugar into your blood. Metformin also suppresses key liver enzymes like glucose 6-phosphatase, directly cutting off the final step that releases sugar into your blood. In short, metformin doesn't force insulin production. It calms an overactive liver at the cellular level, one of the true root causes of high blood sugar. But metformin's power doesn't stop at the liver. It reaches muscles, fat tissue, and even your gut. Let's see how it affects your whole body's blood sugar system. In muscle tissue, metformin increases glucose uptake by helping transporter proteins called GLUT4 move sugar out of the blood and into working muscle cells.
Metformin also makes your cells more sensitive to insulin, so the insulin your body already produces works more effectively to lower blood sugar.
In the gut, metformin boosts GLP-1, a hormone that slows digestion, reduces appetite, and further helps control blood sugar spikes after meals.
Research also shows metformin reshapes your gut microbiome, increasing beneficial bacteria that produce short-chain fatty acids linked to better metabolic health.
Put together, less liver sugar production, better insulin sensitivity, and improved gut signaling, metformin lowers blood glucose without causing dangerous low sugar crashes. The landmark UK-PDS study in 1998 found metformin reduced heart attack risk and diabetes-related deaths in overweight patients, a benefit unique among diabetes drugs. Unlike many diabetes medications, metformin is weight neutral and can even cause modest weight loss, a rare advantage for long-term metabolic health.
Metformin is also widely prescribed for PCOS, polycystic ovary syndrome, where it helps restore hormonal balance by improving insulin sensitivity.
Some researchers are even studying metformin for longevity. The ongoing TAME trial is investigating whether it can slow biological aging itself. Several observational studies link metformin use to lower cancer risk in diabetic patients, though researchers stress this is not yet proven as a direct treatment. Now the tougher side. Up to 25% of users experience nausea, diarrhea, or stomach cramps, metformin's most common and immediate downside.
Long-term use can reduce vitamin B12 absorption, sometimes leading to deficiency, fatigue, and nerve problems if levels aren't monitored by your doctor.
In rare cases, especially with kidney impairment, metformin can trigger lactic acidosis, a dangerous buildup of lactic acid. It's rare, but it can be life-threatening. Doctors avoid metformin in people with severe kidney disease, and it's often paused before contrast dye scans or heavy alcohol use to prevent complications. For most people, metformin is a lifelong medication. Studies show its benefits are strongest with consistent, long-term daily use under medical supervision. For millions, metformin has meant steadier blood sugar and fewer complications. Like every medication, it's a tool, powerful, but not without responsibility. Metformin lowers blood sugar by calming the liver, improving insulin sensitivity, and supporting the gut, but it carries real risks that deserve respect, not fear. Always talk to your doctor before starting or stopping any medication. Combined with diet and exercise, metformin can be one part of real diabetes management. If this helped you understand metformin better, hit subscribe and tap the bell, because on Diabetes 2 Reversals, we break down real science every single week.